So Tonic was founded 2.5 years ago. Our first client was UCSF. They had a problem in which they're doing a large breast cancer research program. They are using the electronic health records of women who come in to get a mammogram as both for clinical care and for research purposes. Right? So their big problem was, how do we get people to fill out this 500, 600 questionnaire? That's a lot, right? And we said, well, why don't you make it, so the initial idea was, why don't you make it fun and friendly on the iPad, which is what we've done here. So, and then once we went from there, we've expanded much more broadly, and now we're working with folks like Kaiser, Mayo Clinic, Georgetown, UCLA, Ottawa Heart Institute, lots of leading providers around the country, New York Presbyterian. And what we've done here, let me get you to our core demo. That was for a client. Tonic is a great application for anywhere that patients need to enter data. So that could be pre-visit, right? That could be on patient intake. It can be patient screening. It can be post-visit, patient satisfaction, patient-reported outcomes, both of which now being tied to hospital reimbursement thanks to Obamacare. Lots of interest in this space. How do we get more and more self-reported data? All right, so Tonic is really the solution that allows us to create more and better data from, or collect more and better data from patients. So the one I'll demo for you here today, Alex, just so you get a sense for this, is the standard patient intake. Right? You can have as many forms you want. On one iPad, we're a cloud-based solution. You can have video playing in the top right-hand corner. We can easily toggle between different types of languages, right? And then this takes us into our core survey engine. And what you'll find here, the central thesis behind Tonic is, if you create patient engagement, and that's a big buzzword right now, right? Patient engagement. If you create patient engagement, you'll be able to create better data. And when you create better data, and better data meaning higher completion rates, more accurate data because people are really focused on it, and the ability to ask up to 50% more questions using Tonic than you can with any other methodology. And the more we know about somebody, the better we can treat them at a lower cost. Right? So that was kind of the core thesis behind Tonic, which is borne out with all of our competitors. So then the question becomes, all right, if you believe that equation, how do we then do that patient engagement piece? And we found it's really through the pairing of contextually relevant graphics with text, right? And when you do that, you create the psychological effect amongst the user of, I can't wait to see what they're going to ask me next, right? Because we've in a way gamified the data collection process, right? So that we've made it simple, fun, and intuitive to use, so that the user, again, is saying, hey, I'm not only focused on every question, but boy, I could do this all day, right? Because they're having fun in the process. One of the other questions I get all the time is, this is free text. We can even, using our online survey builder, which I'll show you, a hospital system can go in and manage all of their own forms and surveys themselves. They can pick from a wide variety of different images, right, that are paired up to the question being asked, and you can manage it all, and I'll show you how to do that online. You can manage this entire process yourself. It's easy to create any survey and deploy it to your iPad. We also have an online version, so you can send people a link. Right? Hey, Alex, you're coming in on Wednesday. Fill this out at home if you want to. Right? And you can use a browser, and it looks very similar to this. Again, how do we make even boring questions like a yes/no much more interesting by adding graphics in the background? Right? And again, you can choose from a wide variety of different images here, and we have lots of different constructs to choose from. One of the other questions I get all the time is, hey, boy, this looks like this would work great with tech-savvy folks, but what about lower income, lower education, and people who've never used an iPad, geriatrics? And one of the things we find, I've got to be online for that, but one of the things, this is a crowd favorite, by the way. Let me be curious to drink.
Yeah, I saw that on the website, and that's one of my favorites too. So, but you should change the beer mug to a glass of wine. I'm more of a wine guy than a beer guy.
You know what? We're adding a cocktail. We're adding a glass of wine too, so people can choose on our survey builder. Which do you want to serve out? Here's questions within a question as well, right? And then it'll do looping question, like you said you had a cough. Tell us about your cough, right? And then here's you had a date and an event. And this was version 1.0. And then our clients started to say, this is really cool. Okay, you've proven to us that you can collect more and better data than anybody else. But what would be really cool is if you could do real-time data analytics on here on the fly. So that was the second piece we added, was all the real-time clinical decision support so that we can do full preventative care and screening before that person even leaves the waiting room. So I'll give you a couple examples. At Georgetown, women who come in for a mammogram are automatically being screened for the BRCA gene, which has a high correlation to breast cancer. And it was kind of a needle in the haystack, but if you find this person, you can really dramatically improve that woman's chance for a healthy life, right? So it's doing using an algorithm that is built on top of the Tonic platform. They're doing 100,000 calculations on the fly before that woman even leaves the waiting room, and high-risk women go towards genetic counseling, low-risk women go and get their standard mammogram, right? So you can actually do patient segmentation in real time right out of the waiting room. Other stuff is a little bit more simplistic, or not simplistic, but a little bit more straightforward. So UCLA is rolling this out across primary care. They're screening for autism in peds, and then anxiety, depression, and alcoholism using simple screening protocols so that it immediately communicates it to the clinician before that patient even leaves the waiting room, right? So they'll come in and say, John Doe. The physician can come in and say, before they walk in the exam room, John Doe, here I'll show you an example of this. Here are the two, this is what a physician will see. This is how John Doe scored on PHQ-9, which is depression. These two are anxiety and depression screenings. PSCY, he scored high on this, low on this. Here are the two questions that Bill Smith answered outside the normal range. They never even need to go through the health history anymore because this is automatically done at form. Right? So it's doing that, again, that real-time data analytics right off the bat. Yeah. Particularly in primary care, a doctor has 8 to 10 minutes to spend with that patient. And they spend 6 of those 8 minutes going through a health history. We've reduced that to about 10 seconds, right? Because it's saying, hey, doctor, only focus on these things because this is the real problem. You can do full cardiovascular screening. You can do full thoracic screening. Really, any protocol or scoring algorithm or risk assessment you want to do. Employee wellness, another great example for this. You can plug it directly on top of Tonic. Here's family history, and then Likert scales. Choose from a broad variety of different Likert scales as well, right? We have an image library to choose from where you can choose the polls. And then when you're done here, you can do any type of e-consent. You can have as many as you want. We can even transpose this signature onto the actual form, so it looks like you've signed the actual form. Patient can review their answers. They hit submit. Balloons come up, which give the user a sense of reward and accomplishment. And then the last screen needed to say, let me unmute it. The last screen needed to say, please return your iPad to the nurse's desk. Which sounds a pretty boring way to end a survey experience that's all about patient engagement. So let's literally have them drag the iPad through the maze to return it to the nurse's desk. It says the same thing as please return your iPad, but it does it in a much more playful and fun way, right?
Oh, wow.
Again, all of this is customizable. I'd say half of our customers turn this on, half of them turn it off. And then at the end, if you're doing a pilot with Tonic, you can measure, which do you prefer, Tonic or pen and paper? We always encourage our customers to do this because it always dramatically comes back in our favor. All right, so this is like a survey satisfaction. If you're doing a pilot, you're like, do our patients like this or not? All right?
Yeah.
So using Tonic, again, you can manage all of your forms, surveys, questionnaires across an entire health system, and you can do real-time population management because we can screen your entire population of the health system across really any protocols that you want, any conditions, any diseases, all using Tonic. Right? And so we connect to the EHR using. Let me just show you one more thing here. We connect to the EHR using the HL7 bridge, so it automatically can be uploaded in that standpoint as well. And then let me just show you one more thing here. Let me close out of this. A couple other applications. We're actually the featured app in the App Store this month.
Oh, wow. Congratulations.
Yeah, thank you. Yeah. But it's kind of funny. So we are getting downloaded hundreds of times a day right now.
Yeah.
Because if you go into the medical for Apple, they're in the medical category, but how many people are surfing medical apps. Like, it hasn't really led to a lot of leads, but nonetheless, it's good validation for us. Here's the demo that you can download off the App Store. So again, patient satisfaction surveys. Here you can put the doctor's picture on here, right? How long were you waiting in the waiting room? What was the bedside manner, right? Would you recommend this doctor to a friend? Was the nurse present? Which of these are most important to you? Rank these in order, right? So these are the types of different constructs you can do. So that's patient satisfaction. Give you a couple other examples here. Here's where you can do dictation. This is particularly important for academic research. So you can do dictation right here, saves it as an MP3 file. Also uses backend.
Does it also do transcribing?
Yeah.
It also transcribes into text?
It will transcribe into text, and we work with a couple partners who do also literal translation, transcribing, like a formal editor. We partner with a company called Entrada. That's all they do. You can do, any type of drawings. We're really expanding the bounds of what people usually think of as it relates to patient data collection. All right, and patient-reported outcomes, clinical trial. Clinical trial is another great example. Let me show you. So say I filled this out and I'm doing my patient intake. It'll say, hey, thanks for finishing the questionnaire, because Tonic will know if that patient is a potential candidate for a clinical trial. Because using our scoring and algorithm, real-time data analytics, it'll say, hey, John Doe, who just took the survey, is a total candidate for this lung cancer trial. Let's message to him right there on the spot. Right? So it says, thanks for finishing the questionnaire. Based on the information you gave us, you may be eligible to participate in a clinical trial about lung cancer. Right? What is a clinical trial? Why should I participate? And it's got some, I can email you information. There's also, what we've added this year is full patient education. So based on your answers, it can dynamically pull up different patient education depending on what you said. So a good example would be, I'm in the waiting room and Tonic knows that I'm most likely going to need a prostate screening today, right? Or in the future. It'll pull up videos and content at the end of the survey experience that says, what is a prostate screening? Why is it important? All right? Cardiovascular, already being used for this in cardiovascular clinics, in which it's using an algorithm to assess whether you're at high risk, medium risk, or low risk for cardiovascular disease, and then pulling up the appropriate education based on your risk level, right there on the spot. What's interesting about that is most patient education is just a blunt instrument, right? I'm going to give it to you, and it may be relevant to you, and it may not. Tonic makes sure that the appropriate patient education is going to the appropriate person at the appropriate time, right? So it's making it hyper-relevant.
So now, with this product, I see it all on the iPad.
Yeah.
Now, once the patient fills out all the information,
yep,
where does that information get stored? Is it just going to be on the iPad, or is it stored like in a database someplace?
Yeah,
or out in the cloud, or what?
A couple different places. As soon as per HIPAA compliance, as soon as a user hits submit, the data gets wiped off the iPad. We have never lost an iPad in a clinic. But let's just say there was a nefarious person out there who did steal the iPad. There's no health data on here at all. So that gets wiped off. Data can be sent one of three places. It can be sent directly to the EHR, Epic, Cerner, Centricity, using HL7. Or it can be sent to a hospital's separate database. We're being used a lot for academic research, for example. They have either REDCap or some other type of database that they want it sent to. Tonic can just send the data directly to there. Third option is to store it. We also have our own cloud-based database, and you can store it on Tonic. And we have a whole patient portal set up that you can go in there, view all your patients that you've seen, or all the respondents if you're doing research. You can do full population reporting with filters, and I can show you that online as well. So you can make really, three options. And I'd say across our customer base, we're probably evenly split. A third of them are using Tonic, storing it on Tonic. A third are sending it to a separate database, and a third are integrating with the EHR.
Okay.
Yeah,
yeah, that's important to know. Because my initial work way back in the 90s and all was all document imaging. Worked on everything from printing, scanning, photocopying, computer monitors, video, all that stuff. Yeah. So one of the problems is if you have a physical piece of paper, you now got to go and take that. You've got to OCR that. You got to go and take that and put that in the computer, and so that you can parse the data. It'll also be OCR, and all the fields need to go into specific places. And we were working a lot with medical documents at that time, and taking the medical records and scanning them in and making those accessible and figuring out where the fields were and what the information was. So doing it this way is much better.
And we map field by field, so that's exactly what happens. It just gets transferred straight in. So if you choose it, again, patient satisfaction is an example of a survey that doesn't need to connect to the EHR. It needs to connect to a separate system, right? So you really can just send the data wherever you'd like.
So and then what's your background, right? And how did you really come up with this whole idea and this concept?
So prior to founding Tonic, I started a company called Chatter, which is one of the leading market research firms in the country. So what that does, and Chatter's clients are pretty much everyone in the video game industry uses Chatter. Most television networks use Chatter. Other folks like Disney, we do a lot of Disney theme parks and resorts. And what they do is they'll come to us and say, Discovery Channel will come to Chatter and say, hey, Deadliest Catch, we just had record ratings last season. Chatter, go figure out what do we need to do for season 2. Actually at this point, season 8 or 9. To keep ratings up. Or Walt Disney World will say, hey, attendance is down. I'm just making this up. Attendance is down. Chatter, go figure out what are the drivers of why attendance is down and what do we need to do. So we do focus groups, online surveys, broad variety of different market research tools, right? But what Chatter because of that, what Chatter really became is an expert in consumer engagement. How do we engage consumers with a brand, right? In the corporate world. So that's where the UCSF project originally came about, was to say, hey, Chatter, you guys are great at consumer engagement. Can you help us figure out how do we get women to come to a UC center for the rest of their lives? Because if we're going to be doing this big breast cancer program, we need these women to come back to a UC center for the rest of their lives because we need to know why the sick women got sick and the healthy women got healthy. And if they only come for 3 or 4 years and then they leave, the data is meaningless because I need to know what happens in the long run, right? Can you help us do that? And it was in that process where the idea kind of came around the data collection piece. The idea being, at Chatter, founding Chatter, I really became an expert in consumer engagement. And can we take those principles around consumer engagement, working with the biggest brands in the world, and translate that to patient engagement, right? The idea being what is most important, helping people engage with, consumers engage with brands should be the same thing that patients, to engage patients with a healthcare system, right? To help us understand them in a much more full picture. So that was really the founding. So I founded this other company. That Chatter still exists. I used to live in Los Angeles. I went to business school at UCLA. I started Chatter down there. It's run by a separate management team. It's still going strong. And
that's great.
Yeah. Every once in a while I have to go in and wave my arms around, but yeah, it's still going strong.
Yeah. Okay.
But I'm full-time on Tonic.